Okay, let's talk about something really important. If you, or maybe someone you know, is taking one of today's super popular weight loss or diabetes drugs, and you've got a procedure coming up that involves anesthesia, then you're going to want to listen to this. We're diving into some brand new safety guidelines that are literally changing how doctors are keeping patients safe. And it's no surprise, right? These medications are everywhere. Millions of people are using them, and for a very good reason. They work incredibly well for managing diabetes and for weight loss. They've been a total game changer. You probably know them by names like Ozempic, or Wegovy, or Mounjaro. Now, these all fall under a class of drugs called GLP-1 receptor agonists. And as revolutionary as they are, they also bring a new variable into the mix that medical teams are now having to address, head on. So what is this hidden risk we're talking about? Well, it turns out the very mechanism that makes these drugs so good at their job is also the exact thing that creates a serious new challenge when it comes to anesthesia. Here's how it works in a nutshell. These drugs, their main job is to slow down how quickly your stomach empties. You can kind of think of your stomach like a sink that's draining really, really slowly. And that's great for making you feel full longer, which is perfect for blood sugar control and for weight loss. But here's the problem. The absolute #1 rule for anesthesia safety is that you need to have an empty stomach. So you have these drugs that are designed to keep your stomach full and this procedure that demands it be empty. What happens when those two things collide? Well, you get the risk of something called pulmonary aspiration. See, when you're under anesthesia, your body's natural reflexes, like coughing, are turned off. And if your stomach isn't empty, some of its contents can travel back up and accidentally go into your lungs. Now, I want to be clear, it's rare, but it's a very high-risk complication, which is exactly why your medical team is so serious about preventing it. And the data on this is pretty striking. Studies have actually found that patients taking these drugs have a 4 to 10 times higher chance of still having food in their stomach before a procedure compared to people not on them. That is a huge jump, and it's one that absolutely demands a new safety plan. So you might be thinking, okay, well, can't I just not eat for a longer period of time before my surgery? Well, it turns out the old rules of fasting don't quite cut it here, mainly because of how long these drugs hang around in your system. In fact, the experts are pretty clear on this. Just stopping the medication a few days beforehand is not the answer. Doing that can open up a whole other can of worms, like your blood sugar getting out of control if you have diabetes. So it doesn't really solve the stomach issue, and it can create new problems. And this timeline really shows us why. Look at the half-life of these drugs. For semaglutide, which is Ozempic, it's about 7 days. That means the drug's effect, that stomach-slowing effect, can stick around for days, sometimes even weeks. Just skipping a single dose before your procedure isn't going to fix the underlying issue. And here's another really critical point from the new guidelines. You might feel totally fine, no nausea, no feeling of fullness, but that doesn't mean your stomach is empty. Research shows that how you feel is actually a pretty unreliable indicator of what's really going on in your stomach. You just can't trust your symptoms. So, okay, with all of that, what's the solution? How do we handle this? Well, medical experts have put together a whole new safety playbook, and the most important recommendation for patients is actually really simple and straightforward. It all boils down to one number: 24. That's right, a 24-hour clear liquid diet. This is the new gold standard, the primary recommendation for anyone on these drugs who's scheduled for a procedure. It's a simple change, but one that makes a massive difference in reducing the risk. So let's just quickly break down what's different. Traditionally, you're told to stop eating solid foods about 8 hours before your procedure. The new guideline for people on these drugs adds a big first step: a full 24 hours of only clear liquids before you even start that final fast. It's all about giving that slow-moving stomach the extra time it needs to really clear out. Okay, but what if something comes up? What if, for some reason, the diet wasn't followed? Or maybe it's an emergency surgery? Well, don't worry, the medical team has a solid plan B. There's a really good safety net already in place. The very first thing the clinical team is going to do is ask this one simple question. The answer is what guides all the next steps. If you followed the diet, fantastic. They can pretty much proceed as planned. But if not, they shift gears and move to their risk mitigation strategies. First, they can literally use an ultrasound right there at your bedside to see what's in your stomach. Pretty cool, right? If they need to, they can give you a medication to help speed up the emptying process. They'll also change the anesthesia plan itself to add extra layers of protection for your airway. And, of course, if the risk is still just too high for a non-emergency procedure, the safest call is simply to reschedule. And all of this leads us to the final, and honestly the most important part of this whole thing, your role in your own safety. Because there is one thing that you can do that is more powerful than anything else. And that brings us right here. You have got to talk to your team. I mean all of them. Make sure the doctor who prescribes the drug knows. Make sure your surgeon knows. And absolutely 100% make sure your anesthesiologist knows. Be specific. Tell them the name of the drug and the dose you're on. That conversation is the single most important safety tool there is. And that kind of leaves us with a final thought to chew on. These medicines are a phenomenal leap forward in healthcare. But with any powerful innovation comes a responsibility to adapt. This whole situation is just a perfect reminder that as our medicines get smarter and more powerful, our safety practices have to evolve right there alongside them.